and everybody standing around. It's just an evolving field. It's one of the most evolving field out of anything. Most doctors don't understand and they don't know some of the procedures, and a lot of them are skeptical about what I do. We can take out a herniated disc, we can clean out the nerve coming out of the spine and free it from spurs, arthritis, with just a camera, with just a little camera called an arthroscopy, arthroscope, where they do arthroscopies of the shoulders and knees. But we've perfected it now. It's evolved into pain management, where we can go into the spine and we can work around the nerves. We can decompress discs. We can actually go in and do what I call a herniectomy. We could just take out, isolate the hernia, which is impinging on the nerve, without even doing a discectomy, and relieve the pain from this pressure. And if we want to, we can do a discectomy. There's quite a few procedures that we can do today. Most of my patients today are up against a major problem. They have been told that they need spine surgery. Spine surgery, when you have a patient who really needs it, I'm the first one to send the patient to a spine surgeon for treatment. However, today, to be redundant, we have techniques now you can avoid major surgery. And not only the interventional pain physicians know this, but the spine surgeons are starting to know it, because there is a certain amount of spine surgery that fails, just like any other type of surgery. The surgeons now are being very selective in picking who truly needs spine surgery. But everybody in between, let's say an epidural to spine surgery, there are bridges now that we fill. And spine surgeons also now are learning to do the interventional. It's called minimally invasive spine surgery. We have organizations all over the world. I've learned how to do these procedures by traveling all over the world. I've been to Korea. In Korea, it's phenomenal on the knowledge and the experience that they have there. I've learned from the big guys in France, from England, all over the country, the United States, Germany. Recently, I've been in the World Conference in Hawaii, where we had 48 different countries in one spot presenting papers on minimally invasive spine surgery. The things that are going around in the United States and abroad, you wouldn't even believe it. It's amazing on what's going on. And we're all combining our techniques, and we're learning it to improve the techniques to get rid of pain from the spine. One of the unique things about minimally invasive spine surgery, as it says, minimally invasive, it's non-invasive. And because of that nature of it, the patient's recovery time is very short. There's less bleeding. There's less pain for the patient. The patient has the procedure done and they're basically awake. A little bit of sedation for amnesia and anxiety, and the patient usually has this procedure done in the same-day surgery and goes home within a couple of hours. The same day they're up and about. We tell them to not do anything heavy or strenuous for a week, and the longer they hold out, the better it is. A patient might ask themselves, who would be an ideal candidate for interventional pain management? If you have a pain that is unexplainable, for example, somebody has an injury, that's explainable. You're hurt, that needs healing. But if you have a pain going down in your lower back, going down your legs or your arms, if you have weakness, sometimes not able to hold something hard enough, or you start to drop things out of your hands, it usually indicates a problem in either the cervical, the neck area of the spine, or the lumbar area, which would be the lower part of the spine for your legs. You get weakness, you have pain fibers, you have muscle fibers, and when the nerves are pinched, they both get affected. You affect muscle fibers, that's going to cause you to have weakness. Sensory fibers, pain fibers, is going to cause you to have pain. And this causes inflammation, and inflammation is what causes pain. Inflammation is pain and swelling. I would recommend is by coming for a consultation to see the pain physician and have him do a complete evaluation, which would be a complete history and physical, and would be, if you don't have MRIs or CAT scans, the doctor would most likely, or I would most likely send you for a new CAT scan or a new MRI, so we can evaluate in detail what the spine looks like, whether you have herniated discs, whether you have tightening of the canals where the nerves go, pinched nerves, and we can precisely pinpoint through your physical examination your history of how you developed the pain, whether it's an injury or just lifting things certain ways, and reviewing the MRI in detail, we can pinpoint precisely where the pain's coming from. And we do an intervention on you, we do a procedure based on all this criteria and all this evidence under strict X-ray guided fluoroscopy needle placement. We use X-ray, intermittent live X-ray, to precisely place the needle where the pathology is, where the pain generator is. And that's where we drop the medication that will decrease the inflammation and decrease your pain. We go to conferences and they've done studies to show that a person who has, for example, an epidural, compared to people who have not had epidurals, and over a 5-year period, at the end of a 5-year period, with this minimally